Hi, I'm Ashley, and welcome to the Ethical Health Communication Project. So the first video was bad communication. The ethical issues I saw, the very first thing is the doctor made it about her. I really need. No, you don't. Right off the bat, Gutman's quote 100% implies interfering with with their right to freedom of choice and autonomy for the sake of promoting health of individuals or society as a whole. The doctor changed patients without consent. The mother was not the patient. The child was. And then the other ethical issue I saw is the doctors talking about potential problems that aren't necessarily going to be caused by the smoking. Sure, smoking can increase the causes, but that's to sit there and put the guilt on and lay the heat down, and say things like what can be more important to the health of your child than the health of your child is just not needed. And it's also extremely misleading information. Really poor way of doing that. Um, Well, what about that approach? Well, people don't go to the doctor because they're having a good day and feel healthy. They go to the doctor because they feel like shit and they need help. All right. So the abrasive approach creates defensiveness and lack of trust. There's absolutely no reason why a primary care provider should be acting like that to any parent. I understand that they see bad parents, but that doesn't necessarily mean just because a parent's making a potentially bad choice makes them a bad person. The lack of empathy also makes the doctor seem very unapproachable. And especially in a primary care provider situation, they're supposed to be approachable. They're not in the emergency department. I mean, emergency department docs should also be. I used to work in emergency department, so emergency docs do definitely need to be approachable. But things are definitely much more on an a tougher timeline in the emergency department, but not in a primary care facility. Well, how about some changes? The doc definitely needs to show some empathy. And remember who the patient is. The mother's not the patient. If the mother had given the doctor the authority to speak into her life, the doc definitely needed to realize that that was a privilege and an opportunity to help. The doctor is absolutely under no obligation to provide care to the mother, only to offer resources. So definitely overstep those boundaries. The good communication video. The doctor does a fantastic job, treats the patient first, and then actually goes into the potential causes of the chronic ear infections with a much gentler approach. She does a great job at leaving room for the mother to speak and just asks questions to better understand the mother's situation, not the baby's, which is amazing. Because the baby was already taken care of. Now to address the potential causes, it was just perfect. Then goes into states, I love the fact that she stated that, yeah, you're right. We're not sure if the smoking is going to cause these. Just might make the issues greater, or it might not be a part of the problems that the smoking can create, excuse me, in general. And the doctor does a great job at seeming interested in what the mother is saying. That approach, though, friendly and open, it was effective dialogue through and through, so full of understanding, not a single lecture to be heard, allowing the mother to convict herself instead of adding convictions to it. The mother's much more open to input and advice because of the much gentler approach and allowing the mother to, I keep saying switching patient and doctor, I mean mother, but the mother 100% was not the intended patient in this scenario. But the mother is so much more open to the input and advice, which is very important for anybody in the doctor's office. The verbal and nonverbal communication that came through, the mother stayed smiling in that second video. The mother stayed upright, too upright. It was obviously a stage video. We all know that. But man, that posture was absolutely incredible. She maintained eye contact and maintained open posture, hands folded. Hands didn't really go up. There's a little bit of talking with the hands, but that's absolutely normal. There wasn't shifting in the chair as much as there was in the first video, having to readjust her position nearly as much. The doctor was so much less aggressive in that second video and a much better listener. The doctor maintained a much more open, relaxed posture, not nearly as much forward movement. It was overall a much better interaction, one that I would expect from a primary care provider. Um, and coming from somebody who's worked in the medical field, Um, more doctors need to see this video. Thank you so much for watching my presentation and have a great rest of your day.